Joining us to discuss all of this are Jack Lipton, the chair of the Translational Neuroscience and director of the COVID-19 Early Detection Program at Michigan State University, and Dr. Lipi Roy, an internal medicine physician and NBC News medical contributor. Professor Lipton, the vaccine we heard about today from Moderna, it sounds like it's similar to the Pfizer vaccine in that it's an mRNA vaccine. Is that right? And what are the differences between these two vaccines?
That's right. So an mRNA vaccine, we in the scientific community are really excited about these. They work differently than the standard vaccines that you're used to, and the Pfizer and Moderna vaccines work the same way. Instead of injecting dead or weakened virus into the body, what we're doing is we're taking a piece of genetic messaging material, and we give that to you, and that goes into your immune system. And particular cells that are called dendritic cells, which are part of the immune system, present the protein that's made by this genetic sequence, and your body then develops an immune response from that. And one of the best things about these mRNA vaccines is that they produce a very specific protein. So this is the protein that's on that virus, a spike protein that's on the outside, which is what gives it that corona-like appearance. And because of the fact that they're very specific with this particular protein, the off-target effects or the overreaction of the immune system is less frequent in an mRNA type vaccine.
Oh, I just had a light bulb moment. My dad is a biologist, and he's been trying to explain this to me for maybe 6 months. And I had a light bulb moment right there in terms of the difference between this kind of vaccine and others. So thank you for that. I hope that was helpful for folks at home. Dr. Roy, Dr. Fauci said today that a formal transition between the Trump and Biden administrations is important to the quick distribution of a COVID vaccine should they successfully be able to make one. Why is it that is it important that the Trump administration cooperate right now with the president-elect and his team to ensure that the vaccine can be distributed to millions and millions of Americans quickly?
Yes, Zerlina, that's such an important issue because I think of it in terms of my inpatient medicine. When one medical team comes on board, they need to get what we call a handoff from the existing team, the team that's already been there overnight taking care of the patients. They know what the labs were, the imaging. They know what acute medical issues are ongoing with the new patients, with the existing patients. You need to have that handoff from one team to the next. It's so critical, especially now. We are in the midst of the worst public health emergency in the history of the U.S. for a very long time, and so many people are actively getting infected, getting sick, and sadly dying. I mean, we're approaching 250,000 deaths, Zerlina. And if you put this into historical context, that's more than the number of casualties, American casualties from World War I, the Korean War, and Vietnam War put together. So this communication is really necessary because we need to know what the current team in the administration has been doing, who their contacts are, who they've been speaking to, from vaccine companies to distribution companies to all of these other players. I mean, this is a complex problem, and the incoming team needs to know that information so that they can plan accordingly. Zerlina.
That's such a good point in terms of the fact that it is complex because you have, the fact that the vaccine needs to get to the high-risk groups, frontline workers, some groups that will need to get it first, and you need to make enough to get to the rest of the American populace. Professor Lipton, what are some of the challenges and the complexity that Dr. Roy was speaking to in terms of what we could expect when they do come up with a vaccine?
So I think if you want to talk about the two vaccines that we're talking about right now that are in phase 3 and are moving forward, the Moderna vaccine and the Pfizer vaccine each have different challenges. One of the challenges with the Pfizer vaccine is the fact that it needs to be kept extremely cold, and so it has a real strong logistics challenge. The fact that you have to keep it at minus 70 degrees Celsius. It means that it has to be shipped on dry ice, and the plans from Pfizer, which is in Kalamazoo, Michigan here, in my home state. They're planning on sending out trucks to FedEx and DHL, sending these things out in airplanes. And you're not going to be able to get this particular vaccine at your pharmacy or in your doctor's office. It's most likely going to be in large distribution vaccine centers or academic medical centers or large hospitals, because it has to be kept cold and it doesn't have a great shelf life once it's taken out, only a few days. The Moderna vaccine is less challenging. It can be kept at -20, which is kind of the standard freezer temperature, -20 degrees C, and then it can be kept out in the refrigerator for up to 30 days. So the Moderna vaccine is probably going to be more widespread in terms of its ability to make it to hotter climates. The challenge that we also have, though, is that Moderna, I don't think is going to be producing quite as much into 2021 as Pfizer is. So in terms of what's going to be available in the U.S., they're planning on having 50 million doses of the Pfizer vaccine in 2020, about 20 million doses of Moderna. And then Moderna plans on having about 100 million doses available in 2021 for the US population. So while it's easier to get it out there, it is definitely going to be less plentiful. But it will be getting to the general population in April, which is super exciting.
Just one follow-up. Is it possible that we may have more than one vaccine, and how would they determine which one you should take if you're a regular person?
I think there are going to be a lot of opportunities there. So you have the two that are coming out right now from Moderna and Pfizer are the farthest along in the process. But Novavax has a vaccine coming. Johnson & Johnson, which has a single dose vaccine, which unlike Moderna and Pfizer, have a 2-dose vaccine, and AstraZeneca. And now AstraZeneca and Johnson & Johnson both had pauses in their studies, but they're ramping back up. So we should have at least five vaccines if everything goes well. And whether there's different efficacy depending on the population that you're looking at, we don't actually know that data yet. But we may see that some are more efficacious in people over 65. We may, and right now we don't know what the efficacy is going to be in children. Pediatric trials haven't occurred yet, and I am encouraged by the fact that these studies that have come out so far have demonstrated their foresight in making sure they focus on people of color, making sure that they're focusing on appreciably on people that have chronic medical conditions and people that are over the age of 65. These people that are often either disproportionately affected or may have additional risk factors for the disease.
In terms of, Dr. Roy, in terms of additional things folks should know about the vaccine, I think it's interesting to sort of lay it out in the 5 different possibilities for vaccines in terms of the status right now. What else should Americans know about this vaccine process? What's going to happen between when the scientists have that eureka moment and when they can get it at CBS? And also what could change potentially, because scientists are very much still learning more things about this virus and this disease.
Yes, Zerlina, we've been saying this for many, many months now. We are literally learning something new about this virus almost every day. The virus itself, the pathophysiology in terms of what it's doing to human beings, as well as on the therapeutic side, therapeutic and prevention side with vaccines. I just also want to add, in addition to what Professor Lipton stated in terms of the distribution challenges and the storage and the shipping, there's also the allocation, right? So the policymakers determine how many doses each state is going to get. So if a state gets 100,000 or 1 million, that's then going to determine the distribution planning for that state. And then, of course, administration, which you and Professor Lipton have talked about in terms of who gets it and when. But, it's also important to remember that the idea of a vaccination, which we hope with these efficacy levels of plus 90%, which is extremely promising, it's also not this cure-all. We don't want people to get this false false sense of reassurance that their behavior suddenly changes, because frankly, we just don't, there's so many unknowns. We don't know how many people will finally agree to take the vaccine. In addition, we really don't know what the duration of protection or immunity is going to be. There's a lot of unknowns still out there. So it's still really important for people to remember that the two measures that we have, the only two to prevent transmission of the virus, is masks and physical distancing. So we really need to continue enforcing that in the public, everyone. And I know holidays are coming up. So really, this is just not the time. This is not the year to congregate in big gatherings with family traveling from all over the country, if not the world. It's just not the time. It's not safe to do so while there's such high community spread of the virus, Zerlina.
It's such an important point. Jack Lipton and Dr. Lipi Roy, thank you so much for joining us. I hope that was educational for